Assalamu alaikum, the communication day. First scenario. 25 years old lady, she had been given birth to her second child 4 months ago. Her pregnancy was complicated by polyhydramnios and ended in a premature birth at 35 weeks. Her premature baby daughter was admitted to the neonatal ICU because of severe breathing problem, where she was intubated, ventilated for 10 days before being gradually weaned off the ventilator, but remained under intensive care for a further 2 weeks. The pediatrics team eventually made a diagnosis of congenital dystrophy myotonia, but that diagnosis was not communicated to her as she was not in a good mood. However, she was aware that her baby daughter was flabby and had a problem with breathing due to the muscle problem. At the prognosis, the disease is progressive, the mode of inheritance is autosomal dominant, the disease has anticipation. Please, the task to explain the diagnosis, the anticipation, treatment, support group, and further management plan. You
Okay.
can, you can start now. Here you go.
Hello.
Hello.
My name is Dr. Ayola. I'm one of the doctors here today. Can I please confirm your name and age, please?
Yes, doctor. My name is Miss Muna.
Mm.
50
And your
years. 40, yes, 40 years old.
All right, nice. It's so Mrs. Mana, I understand that you had a baby about 4 months ago. Is that right?
Yes, doctor. Actually, doctor, I'm very sad regarding my baby daughter condition.
Okay. Okay, so today we are here to discuss about this baby, where we are in our management and what we hope to do for her, for the baby. Is that all right, Mrs. Monet?
Yeah, okay, doctor, please.
But before we proceed, how have you been in the last 4 months?
Yes, doctor. Actually, I have a baby before 4 months. Actually, I delivered this baby where it's at the age of 35 weeks. So I'm very sad, doctor, because my baby daughter was floppy and she has breathing problem and now admitted in intensive care. And also now she is connected with the breathing machine, doctor. So please tell me
Right.
what happened to my baby, doctor.
Yeah. Not to worry. We'll discuss all that has been going on with your baby so far and what we intend to do. But first, I must acknowledge that this might be a difficult time for you, having to see your baby admitted in the, special baby care unit. I'm so sorry for all that you've been going through. Okay, and so far we've been able to wean your baby off the breathing machine. We took over our respiration for sometimes about 10 days, and we've been able to wean the baby gradually off the machine. This is what we do oftentimes when we want to wean off gradually. But is also currently it has also remained under the care of the special baby care unit, and she will remain there for about 2 weeks. Okay, are you with me, Mrs. Uda?
Yes,
All right.
doctor.
Okay, do you understand what I've said?
Okay, so doctor, yes, could you explain for me more?
Okay, so over this period, the baby doctor have been assessing your baby, because usually when baby is born at this earlier than they should have been birthed, the doctor will look after them, and they've tried to look at why she's born earlier than it should have, and why has she been having this breathing problem. So they've come out to there's a diagnosis for that, and they've found the reason for this. And unfortunately, Mrs. Huda, it is not a good one.
Oh, doctor, what do you mean by that, doctor?
Okay. Mrs. Huda, are you all right to continue with this conversation alone, or you want someone to join to come join us?
No, doctor, thank
It's
you. You
okay.
can continue this.
All right. Okay. So they've come up to say that the diagnosis is a condition called congenital dystrophy myotonia. Have you heard about that before?
Never, doctor. What is this?
Okay, all right. So I can explain to you. It's basically a condition in which the baby is born with problem with the muscles, and the muscles are unusually weak than it should
Mhm,
expected, and this could affect their breathing, their movement, and they could also become very weak, like we found in your baby.
mhm,
This diagnosis was found earlier, but because the situation surrounding the birth and the stress that you were going through was not communicated. So that's why we are
mhm,
having this communication now.
mhm.
Do you understand what I've said, Mrs. Huda?
Yes, doctor. So this condition, is it serious, doctor?
Well, Mrs. Huda, I'm afraid to tell you that it's actually a serious condition and it's likely to be progressive in your baby.
Mm,
But not to worry, we will look after her and as much as we can, because it's not something that is treatable, but we can manage in, because it's likely going to progress to have worsening of movement, possibly difficulty with breathing, even with
mhm,
eating, possibly. But we will
mhm,
support her as much as we can by referring her to the hospitality team. Well, our growth will be monitored. The
mhm,
our movement will also be supported. Our feeding will be supported if there's need. Respiratory will be supported as much as we can. This is to ensure that she lives as close to normal as possible. But she will continue to the disease will continue to progress, and the weakness, even as she grow, the weakness will continue. Do you understand what I've said, Mrs. Huda? Have you
Yes, doctor. Yes.
have you got any concern, any question for me at this point?
So is there any uh, treatment available for this condition, doctor?
Oh, Mrs. Hood, unfortunately, there's no treatment available for this condition. We will just keep monitoring her and keep supporting her as much as we can. We
Mhm,
have support group that can be of help for her. We'll be referring you to we'll be giving you more information about this as we progress. There are specialist nurses that look after such condition as well. They will
mhm,
also counsel you and talk to you about what to do for her. Okay?
mhm.
Have you got other babies, Mrs. Huda? Other
What?
children? Have you got other children?
Yes, doctor.
And is there anyone affected with this condition?
No, actually, doctor. Yes, I have a kids. One kids.
And
Apart
is
from this,
is the child affected with this?
no, doctor. This is a first. This is a second baby, doctor. For
Okay.
me,
Okay. What
yes.
about your husband, the father of your baby?
Mm-hmm.
Okay.
No, doctor.
Okay. Because I'm asking this question because we need to know why would your baby have got this, because is a disease that can be passed on from the parent on through the children. And the
Mm-hmm.
mode of inherit and the way it is passed is the chances of being passed from one generation to another, from the parent to the children, is about 50%
Mm-hmm.
chances, and that's why we need to know if any one of you have this disease. Okay, but since you've told me that none of you have this disease, sometimes it can happen. We don't know why it can happen. It could just be a one-off thing that could happen
Mm-hmm.
in a family, but it's oftentimes a disease that transmits from one generation to another. Are you with me?
Mm-hmm.
Two
Yes,
minutes
doctor.
left.
Okay.
So
Do you have any question, any concern at this point?
yes, doctor. So can I do a test for my second child, my first child?
Um, Mrs. Wood, I can only imagine what is going through you now, through your mind now, having a child that has been diagnosed with this. But however, because you told me that your first child has not exhibited any of these symptoms, I would not advise that we go ahead to do the testing
Mhm.
for her, for the baby, because this might be knowing fully well that you have, this might, you might have, might be a form of distress to the family. And oftentimes, if there's no symptoms, we advise that the child grow up and make a decision if he wants to be tested to know whether he has this disease or not.
Mhm.
Are you with me?
Yes, doctor. Okay.
Okay, and also there's also one thing we need to discuss as well, that your baby has the possibility of transferring this disease to our children. So
Mhm.
we just need to let her know. And this disease often, when it's been passed from one generation to another, it
Mhm.
usually occur earlier than it has
Mhm.
happened in the other in the parent, and more severe. So it's just so you know about it. But not to worry, I'll give you materials on this, some leaflet that you can read that will give you a
Mhm.
better understanding and how to support your baby as much as you can. Have you got any
Mhm.
question at this point?
Okay, doctor. So how can I take care regarding my daughter baby now?
Can you do what?
Can I take care? How can I take care regarding my baby now?
Can you do what? I didn't get that, please. Can you?
Yes. Yes.
I didn't get the question. I'm so sorry.
Yes.
She,
How
she,
can I
she's,
take care regarding my baby now?
How what?
she can take care, how she can take care of the baby, how she
Okay.
can look after her.
Okay. For looking after the baby, this baby would need a special care. Like, if she's flop, she's weak, respiration, she can aspirate when you feed her because of her breathing, feeding can be affected. So what we can do now is to help. We will need to talk to the specialist nurses. The nurses will put you through the special feeding ways to feed. We could also consider
Mm-hmm.
using some special tube to feed her for now. But right now, I don't have full details about this. But the nurses will be able to have conversation with you. They are quite good in teaching mothers how to handle baby like this. Okay?
Mm-hmm.
Do you understand what I've
Okay.
said?
Yes. Okay,
Oh,
doctor. Thank you.
all right. Are you able to okay, in summary, today we've talked about your baby.
That's it. A time is up, Dr. Ayula. Okay,
Right, thank
one
you.
minute even
Yes.
added. Okay, if you want to specifically ask about one single point in this
Mm.
scenario, what should you ask about?
I'll ask about a living condition at home, support
No, no, something else. So for the future.
for the future. Okay. For if she wants to get pregnant again, we can do
Perfect.
some
That's
genetic
it.
testing
Okay. Yeah,
for
thank you.
her.
This is
Yeah.
the point. Thank you
Mm-hmm.
so much. Okay. Well done, Dr. Ayula. Now the comment from Dr. Sarah, then I will comment.
Yes. She did well. Um. She covered most of the topic, and also she answered the concern. Just yes, just she need to talk regarding the complication of these conditions more, like it can affect the heart muscles and also the eye and other manifestations or complications with these conditions. And also, we need to involve many group of specialists regarding a team regarding the heart conditions now, the nerve doctor, physiotherapist, heart doctor, eye doctor, okay, and speech and language therapist. Apart from that, she covers
Okay.
anything.
Yeah,
Mm.
thank you, Dr. Sarah. It's a new scenario or new old scenario and famous one that comes nowadays. And I think Dr. Ayula covered the most important points apart from the planned pregnancy. As any scenario, whenever you have a female patient in the childbearing age, you should ask about the pregnancy plan. Why? Because it should be planned one. Okay. And
Mhm.
this is the only condition you should screen the patient. So if you want to have a safe baby with a safe pregnancy, the mother should be screened first, genetically, I mean, and later on, she can be planned with the genetic counseling team under the follow up to have a selected over a way and save from the disease or the gene carrying the disease. This is the only way she can get a safe baby. However, the affected baby now, yes, Dr. Ayula explained the condition and the weakness and the possibility to have or even to die, Dr. Ayula. Okay, be sorry for that, but she might be unable even to survive. She cannot do even with support. She might die, either because of recurrent chest infection, pneumonia, or cardiac issue. Okay, so sooner or later, the mortality or the outcome of this baby condition will be very poor, and she might die even with all these kinds of supports, right? So the other point to be explored here, and Dr. Ayula already addressed it properly, no need to screen the coming or the already current baby. So she had a child. Is it necessary to screen her? No. And if any symptoms appear on her, please bring her back to us. What kind of symptoms? Any weakness, any heart issue, any vision issue. So we are talking about the manifestation of the disease, particularly the muscle part. So whenever or anytime your daughter having weakness, she cannot tolerate the daily activity, or she has some breathing issue, immediately bring her to us. Any heart or awareness of heartbeat issue, bring her to us. Any vision issue, also bring her to us. Sometimes diabetes is associated, so the symptoms of diabetes can be explained even to the mother because now the mother is intact, right? She doesn't have any manifestation of the disease. However, at any time she might have the manifestation of the disease.
Mm.
Why? Because we are talking about anticipation. So this generation maybe still didn't have the time for the manifestation, and the next generation might be earlier and younger than her. But the most important thing in this scenario, screening for the future. I mean, planned pregnancy. Otherwise, the other concern address well. The introduction, even here, you can, of course, ask for invitation. You can invite her husband because the baby already, I think here you can invite because she's still a baby. And the other introduction, what do you know about hair condition, the background, everything here was okay from Dr. Ayula. I think perfect as a performance, as usual, Dr. Ayula. You have any question? Dr. Sarah, any question from your side?
No, doctor.
Okay. Again, the multidisciplinary team approach should be involved for the baby, including the baby doctor, the physiotherapy or the physiotherapy doctor or specialized nurse, of course, even the breathing support guy, he should be involved, I mean the RT. But of course, whenever you are specifying or mentioning a team, should be in non-medical way. So baby doctor and some weakness or muscle strength specialized person for limb physiotherapy, I mean. For the breathing machine and breathing support, a guy or a specialist, he will be also attending. Plus, genetic counseling should be attend for the future plan of pregnancy. You should involve all of these. Okay. Any other question from anyone? So the concerns here are clear. Anyone has doubt about any concern?
Yes, Dr. Basim. When she asked her about the screen for the other child, I think
Yes.
it was better to ask firstly what's his age,
Okay.
because she assumed. I think I don't know if she asked it already or no.
She
But
assumed that she's a child. Okay.
he's a child. Yeah, I think it's better to
Okay.
ask
Yeah.
yeah the age of the child first. Yeah.
Mm.
Okay. So what's your point? What's the difference
Mm.
if she is
The,
young or
the,
she is
the,
adult?
Uh,
Mm.
yeah, if he's young, we will give the advice that screening will not beneficial and will put him in a stress and also it will affect the insurance. And
Okay.
if he is adult, we can offer him referral to the genetic counseling
Okay.
team to give him the pros and cons of doing the screening, and then he will decide for himself. She
Mhm.
mentioned this later also. She told that when he is getting older, we can discuss with him, and he will decide for himself if he want to be screened or no.
Yeah, okay. For somehow I agree, but in general, no need, and it's not something to be encouraged. If
Yeah,
she
it's not as
insists,
advised. Yeah,
yes, it's not as advisable. But if she insists to do, that time you can raise the issue of the age. You got it? So you will not offer it unless she asks, doctor, please, I want to be sure about his condition. I want to be sure that he will not have the disease. Or is not that time you can tell her, yeah, if he is younger, no, we cannot do it, or it's not necessary to do it, and no choice for him to take a decision. However, whenever he is above 20, for example, or 16, according to the age there, I think 16, and he want to decide for it, that time we can refer him to the genetics counseling team. So it will not be her choice. It will be his choice in the future whenever he's passing the age. Okay.
And
Any.
I think the main important thing is to ask if the child is symptomatic. If he
Yeah,
has
the
any
only thing
symptoms,
you have to do exactly the symptoms. Whenever he has symptoms, bring him to us. That time we can screen him or her. You got it, Dr. Ala? I agree for this.
yes, yes, Dr. Basim.
Okay. But if she, the point, if she asked to do it, I please, doctor, no, do it for him. I am his mother. I want you to do it. By the way, this is a tricky point in adult kidney or adult polycystic kidney disease.
Yeah, that's
Yeah,
why
this is okay.
we
That
should
in
first
that
ask about
condition,
the age. Mhm.
exactly. This condition only, I mean, in the adult polycystic kidney disease, that time you will tell her, okay, we will ask him if he want to be screened. After his decision, we will do it. Okay, but it's something to be advised. So it's advisable to ask the autosomal dominant polycystic kidney disease to screen not only the son or the daughter, even the siblings. So all siblings should be screened and offsprings as well. So the brother, sister, as well as the children. You got it? But here it's not advisable. Even the age is young or the age is old. It's not something to be screened for because we don't want to discover it. And if we discover it, the patient will have stress. No benefit, I mean, no medication. The only thing he will lose, he will lose also the insurance plus the distress in his life. And the benefit of medication will be zero because no medication can control or cure the disease. Clear? Okay.
Dr. Bassem,
Yes, Dr. Ahad.
can I ask?
Sure, sure.
If there is a disease with the poor prognosis like this disease, why we will do for him screening?
The only
What we will
situation,
change? If we do?
the only situation to screen whenever she is planning for pregnancy or whenever the adult male planning to have a baby. So we can do genetic selection by through ova or sperm
When,
selection.
sorry,
Yeah, this is
you
the only
mean when the
situation.
child grow up, when the
No, no.
child
When the child
for
grow up, no need to screen
yes.
him. What the benefit of screening if he will not have any medication? Okay,
Okay, why I screening him if he is still child, doctor? Also, if
we
I
will not.
discover he has this genetic,
We will not screen. I didn't say we will screen.
really, I'm not get the point of this.
No, no, no. Listen, listen. There is disease in bases and medicine, not in bases only, but bases wise. Some diseases discussing in the communication scenarios, you have to screen for them. One of them, autosomal dominant polycystic kidney disease. Why? Because you could control the disease. You can give some medication to control the disease, like tolvaptan, and so on. Okay, so there is some medication can control the disease, but in other conditions, like and the HOCM as well, HOCM one of the condition can be screened, or you should screen for them. Why? You can even prevent cardiac death. So whenever you have HOCM or autosomal dominant polycystic kidney disease, you can ask the patient to screen him and his family. In the other arm, if you have a disease like Huntington and our disease today, myotonia dystrophica, it's not something advisable to ask the patient to bring his family to assess or to screen them. Why? Because I will not get any benefit if I diagnose them with the disease. I will not give medication. I will just support them.
Yes, yes. Okay.
You got
Thank you
it?
very much.
Oh,
Yes,
okay.
yes, doctor.
Okay, thank you, Dr. Okay, I will read the scenario for Dr. Sarah, then we will read the other comment or anyone has question. Your scenario, Dr. Sarah. You
Okay.
are the specialty, your specialty registrar in medical unit. Mr. D. Silva, 21 years old man, was admitted to the acute medical unit 2 days ago following a 5-day history of diarrhea and vomiting. He has been a soldier in the army for the last 4 years and has recently returned from overseas for a period of home leave. He had been out with friends celebrating his 21st birthday. The day before becoming unwell, the diarrhea quickly settled, but he continued vomiting until the day of his admission. Upon arrival to the ward, he was lethargic, dehydrated. His blood glucose on admission was 38.6 millimole per deciliter. He was diagnosed with type 1 diabetes and diabetic ketoacidosis secondary to viral gastroenteritis. Your task is to speak with Mr. T. Silva, explain the diagnosis of type 1 diabetes, address any concern he might have. If you're
Okay.
ready, let me know. The other comments in the scenarios. Okay, communication. Yeah, someone asked about is this scenario related to the medicine or media? This is the only scenario in basis. They are bringing a child or a baby after delivery, and he has this manifestation of myotonia dystrophica, neonatal, I mean. And you have to talk to the mother about the disease as inherited one, as well as anticipated one. So you will talk about these points. I like when Dr. Ayula explain every point in the scenario. For first of all, the warning shot, she did it as breaking bad news. Definitely, this scenario is breaking bad news. No one can argue about that. Why? Because this daughter or this baby will die soon or later because of the manifestation, because of the weakness, whatever the cause of death. Then the point of ventilator, she explained. The point of screening, autosomal dominant. So every point in the scenario you should discuss. They will not write something randomly. They wrote it to deliver it to the patient. So she talked about autosomal dominant, the mode of inheritance. She talked about the anticipation, even the group team support, she mentioned it. So please, whenever there is a task, try to do it in your discussion. Try to deliver this news or this plan or this management to the patient or to the surrogate. So the examiner will know that you are aware about everything in the scenario. You didn't read the scenario only to prepare yourself. No, you are preparing yourself and you are knowing what you will talk about. Okay, Dr. Sarah, whenever you're ready, let me know. Okay, one more comment. Again, for the screening programs, there is certain scenarios. I have the message in the group, recalls group, or sorry, not the recalls, the practice group. We collected the point or the scenarios of screening. Autosomal dominant, one of them, the HOCA, the Huntington, and myotonia dystrophica. All of them comes in phases. So you have to be ready how to do the discussion. Is it advisable or no? Is it something well, and he will have advantage if he screen them, or just he will have the disadvantage of screening, the genetic counseling. All this point will be discussed, and we have a collection of these topic. I will refer and I will message this after the discussion, after the meeting, I mean, to the WhatsApp group, okay? Anyone has question for the screening scenarios? So clear now? We can start, Dr. Sarah?
Okay. Yes, okay.
Here you go.
Okay, hello.
Hello, doctor.
I'm Dr. Alder Karim. I'm one of the registered doctor covering the acute medical unit today. May I confirm that you are Mr. Deliver, 21 years old?
Yes, that's me, doctor.
So we are here to talk regarding your health conditions. Is that okay with you? Just to be in the same page, could you tell me how much you know regarding your health condition so far?
Yes, doctor. So about 7 days ago, just exactly last week, I turned 21, which is a big one for me. So I went on a trip with I celebrated with my friends. I was out having so much fun. And after then, I noticed that I had started to have pass loose too, and also started throwing up. And I became really, really so unwell beyond my imagination. And then I found myself, I've been here for about 2 days now, and I think I'm doing much better.
I'm sorry for suffering, and it's good thing that now you are become better. But yes, actually, after we did for you some blood test, the result of your blood test now with me,
Okay.
and I'm sorry to tell you that it is not good.
Okay.
Actually, they reveal that you have a condition called type 1 diabetes.
All right, doctor. What does that mean?
Yes. Do you have any idea regarding this before?
Well, I've heard about diabetes, but I don't know what type 1 means.
Yes, because of your blood test, it shows that you have high blood sugar in your blood. And so regarding this type 1 diabetes, okay, so please follow me. I will draw for you to make it simple to understand it. There is the gland in your tummy, which you call pancreas. This is responsible to secrete special proteins, which you called insulin. This
Okay.
insulin, it is most important to regulate the blood glucose in your blood to transport it to your organs and your tissue. So in your condition now, there is deficiency of this protein. So that is why you have high blood glucose now in your blood. So the cause of this, it might be there is the damage of the cell that's secreting this protein. So that is why one of manifestations that you are suffering from now, like yes, and I'm sorry to tell you that now in your condition it's complicated with which called diabetic ketoacidosis, because now you this high blood glucose in your high blood glucose and because this glucose is not transported to your organs, so the organ is started to destruct the fat, and also it transport it to acids, which is a harm for your blood that develop this diabetic ketoacidosis. Are you following me?
Yes, doctor. Honestly, I must say that you've given me a lot of information about
I'm
this
sorry for
diabetes.
that.
Okay, it's okay, doctor.
That.
But my only concern is really, like I told you earlier, I'm feeling much better. Okay, I'm feeling much better today, and I'm looking forward to be discharged. Honestly, I thought you were coming to discharge me because I'm much better, and I want to go because I'm planning to resume at my new place of work in about 2 weeks' time from now. So all that you've talked about, how will that affect me? Because I'm not quite sure. What will you do for me? And will I be able to go home now?
Okay, so before we need from you before you are going to home or to be discharged, regarding your conditions, that is why this condition it might be put you at risk to develop many complications, like if your condition not control and your blood sugars not control well, it can affect your visions, and also it can affect your kidney, and it can affect the nerve. Okay, so
Okay, doctor.
that is why we need to put you in the group of specialists, in which include the gland doctor, and also we will involve diabetic nurse. We need to give you and to replace this deficient protein insulin
Mm.
through the needles to
Okay.
control your blood sugars. So,
Mm.
what do you think regarding starting insulin?
Well, that sounds scary to me, I must say, because I don't like to be given injection. And honestly, because I don't want to be given injection. Can I have this insulin by tablet? Is this something you can do?
I understand your worries. Actually, this insulin just should be taken by the needles. No tablets available,
Mm.
and this is yes, it is prescribed for you in the best interest of your conditions, to control
Okay.
your blood sugar and to avoid any complications. So, may I ask you if you have any reason um, because you are not willing to start this medication?
Yeah, because you just mentioned to me that it will be via injection, and I
Mm-hmm.
don't like injection for any reason. I don't like to be injected. If it's tablets, I can take as much tablet, but injection, no, doctor, no.
Mm-hmm. May I know why?
I have phobia for needles.
Mm-hmm. So I understand your reaction, your situation as well. Regarding, I would like to reassure you, this the needles is like a thin and less painful, and also there is insulin pen that might be less painful, and also there is another option like insulin pump
Mm.
device now. We can refer you to diabetic nurse to teach you regarding how you can use it, this insulin pump, and how
Okay.
can you deal with it.
We can give that a shot. We can try that, doctor, and see if it's something I want to go on. But doctor, how do you think I've got this diabetes? Because I've been drinking. I drank a lot during my birthday party. Do you think that might be the reason why I've got this diabetes?
Mm-hmm. Yes, I highly appreciate your concern. Um, Regarding the cause, not it might be not related, but not related to your conditions, because the cause of diabetes, it might be due to damage on the cells, or disturbance in defense system.
Mm.
Also, I advise you to keep you with yes, healthy diet, and to avoid the high glucose diet, and also we involve you with dietitian to teach you more regarding which diet is more suitable for your conditions.
2 minutes left.
Okay, doctor, that's good. So I assume
Okay.
if I take the if I take the insulin, I'll be cured. How long do I need to take the insulin for? And I assume I'll be cured. Is that it?
Yeah, I'm sorry for that. Actually, this condition is not curable, but we will give you this insulin to control your blood sugar and to avoid any complications. And
Oh,
I'm
oh,
sorry to tell you that it is like lifelong medications that should be given for you.
oh, there, oh, there.
Yeah.
It's okay, doctor. It is what it
So,
is. It's all
yeah,
right.
okay. So also we need yes we need from you to follow lifestyle modification, like exercise
Mm.
program, regular exercise. This is the most important for your conditions, and to follow health diet also. Do you have another concern for me?
No, just that I'm planning to go back to work in 2 weeks' time.
Mm.
So I'm not quite
Mm-hmm.
sure how that will affect me. Honestly, I'm not quite sure.
Okay, actually, also, can I know what is your job?
I work in the army. I'm a soldier.
Mm-hmm. Mm-hmm.
Mm.
Okay, so I'm sorry for that. Actually, I advise you to avoid any vigorous exercise or strenuous exercise that can put you to lower down your sugars. And also, when starting this insulin, yes, one of the side effects of this medication, it can cause for you this low blood sugar in your blood. So at any time, if you have any like shakiness of your hands and blurring of visions and hunger pain, please keep with you sugary substance and take it, and also came urgently to seek advice for that.
Okay, doctor.
So may I ask you if you do you smoke?
No, I don't.
Okay, so I will yes, so I will provide you with the brochures and trusted website to read more regarding your conditions and how you can control it, and also we involve you with a support group to share their experience with you also. And this is the contact number. At any time, if you have any worries or queries, please don't hesitate to ask us at any time. Is that
Okay,
okay?
that sounds reassuring, doctor.
Okay, thank you.
You're welcome.
Okay, time is up. Thank you, Dr. Sarah. Well done. Let's hear Dr. Oyula comment, then I will comment.
Okay, well done. It was a good presentation, I must say. Good way of starting, good presentation, good communication. You told me about the diagnosis, you explained what the diagnosis, but just one thing I have noticed that you gave me a lot of information, which I probably do not need. That is my own thinking anyway, especially when you were trying to explain diabetes ketoacidosis to me. I probably think that this took a lot of your time. And possibly you could just say that unfortunately you've had one of the complications of this diabetes, which which is due to buildup of toxins in your body because of the vomiting and the throwing up and the diarrhea that you have had, and we've given you fluid, and that has helped with that. Then that what I think anyways, that could have shortened those explanation of acidosis. I don't know what acid means in my body. I don't know what that means. Just something to tell me that I've had some complications. Then yep. That's one thing I thought about. Then when you are counseling me on insulin, do eventually you talk about it. But I think that counseling on medication, especially lifelong medication. Okay, let's start from the diabetes, from the management, the counseling on management of the diabetes. I think the first thing, any diagnosis that has no cure, it's always good to let the patient know as early as possible that unfortunately for this diagnosis, for this diabetes, there is no cure. We can only manage it with the use of insulin and to keep it under control. And the aim of this is to prevent complications from happening, such as the ones you've come down with and other ones that you mentioned. Do you eventually mention all of them? This can happen. So we recommend that you stay on your insulin we'll give you a prescribed dose. It's going to be given the route of giving, which you did, which is you talk about that. You talk about the possible things, how it will be given, and the possible side effects to look out for. You eventually did all of this at the end, which is good. But maybe if you put it in one sentence altogether, I will not have. I will not need to ask you again. So for every counseling on medication, you talk about the aim of medication, you talk about the route, aim of the treatment, the route of giving the treatment. If you know the timing, you can say maybe twice a day, once a day, depending on how it is prescribed. I do prefer to say that depending on how it is prescribed, then of course it has its benefit to keep your glucose under its control, but of course there are some side effects that I want you to look out for. That's what you just mentioned, the headache, the blurring of vision, the feeling of as if you are feeling drowsy. At that point, it can lower your glucose and can give you the symptoms. So you could advise to take sugar containing fluid. So at all time, because you're on insulin, you should have a sugar containing beside you. But not to worry, we'll give you leaflet about this, and the nurses will talk more about this with you. Is that okay? Are you following? That's it. That being said, then another thing I want to talk about is this patient occupation was put there for a reason. There's a reason why his occupation is there. And this is a soldier, and he will deal with equipment, dangerous one. He would deal with gun. He would be involved in rigorous exercises. These are things that needs to be put into action. And for him, his job, for anybody taking insulin, there are some jobs that they need to be careful of, especially for those of them that have started to have hypoglycemic unawareness. And that's people include those with heavy duty that drive buses and taxis, commercial, heavy goods vehicles, those in armed force, air pilots, those that also climb heights, those jobs that are risky, that can put the person's life into danger as well as other people's life. When they are on insulin, a glucose lowering agent or agent that can cause hypoglycemia, we need to let them know that their job is at risk and caution, or possibly start thinking about changing their jobs at that point. The job was put there for a reason. So basically, that is it. But you did so well. Well done.
Yes, thank you so much, Dr. Ayula. You explained in details what to do, how to do the scenario. I agree about the details of Dr. Sarah. Sorry, Dr. Sarah, about this comment. But really, the patient doesn't want to hear about all these details as biochemistry. Patient want to know what's his diagnosis as a name, the manifestation, as usual, how to counsel about the disease. The good way you started with, that you start to draw. But when you went through the complication and burning the fat, he will not understand. You waste the time, and based on that, you didn't have the time to address a lot of things like alcohol and smoking,
Mhm.
as well as the driving, as well as the job itself, supposed to be, as Dr. Ayola mentioned, not to be in the same job, or at least he can give him a paper that he cannot tolerate this job. But from our side, you have to warn him that the job will be risky for him. It might threat his life. Why? Because he's doing a lot of exercise that might harm his life.
Okay.
Okay, another point. I will ask Dr. Ayola this question.
Mhm.
So, do you think type 1 diabetes not curable? And if it is curable, what is the cure way?
Yeah, I think it's curable, and you can do a pancreas transplants,
Yes. So, whenever
beta
he
cell
asks,
transplants. Yeah.
yeah, so don't close this door.
Mm.
Particularly, he's young, and there is a way for cure, which is pancreatic transplant. So, as Dr. Sarah, I think she said no, it's not. No, you have to remember at this point. It's one of the things can be cured with transplant. However, it's major
Mhm.
surgery and need to be on immunosuppressant and so on the complication of the immunosuppressant. But still, it's something can be cured with the pancreatic transplant. But this is not our point. Our point is to talk about insulin, the side effect, and the possible serious complication, which is, and Dr. Sarah also didn't touch it, the hypoglycemia. Why? Because the time was less and short. You didn't have the time to explain about the most serious things and the most common complication happen with hypoglycemia. And this is
Yep.
one of the, right?
I mentioned it later. Just
You mentioned, sorry, I didn't hear it. If you
yes.
mentioned it's okay, sorry. Sorry, I didn't hear it. Okay, but should be in details, as Dr. Ayula said. Yeah, so you should keep something sugary with you. You have to have a candy
Yes.
and aware, yeah, give awareness to all your friends, your family, how to deal with you whenever you have these symptoms, because you don't know what will happen. Sometimes even you will not feel the symptoms. I'm talking about an awareness hypoglycemia or hypoglycemia unawareness. So you have to give and educate your friends to deal with you whenever they feel you or they see you fainting. Okay, so how to do? To give me candy or to call for help. But you should inform them. Okay, if she said, Doctor, please, I don't want anyone to know that I am diabetic. No, it's something not to be advised. So you should advise her or him to inform his friends, to inform his family member in order to save his life whenever he has this complication. Okay, so this is one of the concern, by the way.
Okay.
Okay, and one of the safety netting, whenever you feel sweaty, you feel hunger pain, you feel
Yes.
unsteadiness, please call us immediately. Call for help. Take your candy and
Sugar is also.
sugar, any sugary diets. Okay.
Mm.
Back to the explanation again. The drawing is good idea, but the patient needs here only the manifestation and the complication. Okay, pathophysiology you can say shortly. It's unknown, or some patients they have defense misdirection. So they attack the pancreas, which is one of the gland in your tummy, which is responsible for a protein that burn the calories and sugars in your blood. In your case, your pancreas already missed this insulin or already finished with insulin. That's why you don't have this insulin inside your blood or body. And whenever you eat or you have any exercise, you might have high blood sugar, as well as one of the complications called diabetic ketoacidosis, which you are presented with after the party you had lately. Okay, don't explain why and burn fat instead of no need. He need only to know the name of the disease, the complication, the manifestation, and how to
Mhm.
manage it. The insulin. Let's
Yes,
talk about insulin.
I get confused because yes, they mention in the scenario regarding this.
Yeah, mention it as one of the complication, but
Mm.
not as a details or as a
Mm-hmm.
pathophysiology. It's one of the
Okay.
complication commonly happen whenever you are doing exercise. You can say the pathophysiology as practical wise or experience wise. How? Whenever you don't take the insulin, for example, and you do exercise. No, this is for hypoglycemia. Okay, whenever you miss the insulin, okay, whenever you miss the insulin and you have sickness with it, which is happen in this scenario, like gastroenteritis, you miss the insulin plus precipitating factor, which is dehydration. Sometimes your body burn some other fat acids or fats, which lead to DKA, diabetic ketoacidosis. In your scenario or your situation, because of the tummy pain or the infection in your gut, plus of course you don't have insulin, the blood sugar went so high, and the acetone or the blood become more acidic or being more disturbed because of the burning of fat. But no need to mention the glucose instead of burning the glucose, burning the fat.
Mm-hmm.
This is biochemistry, but you can do it as experience wise, as I said exactly. Okay, back to the disease. Yeah, the insulin. You mentioned the insulin, and she told you about the phobia. You give her a solution, which is small pen with a small, very minute pin, pen with
Mm.
pin. Okay, and you will just feel a brick without feeling something getting inside your body. Or by this way, you will not feel the phobia, or you will not be having phobia for the needle injection. It's not a needle, it's a small pin. The other thing, you raised the issue of insulin pump, right? Although it's not in the scenario. So if you want to raise it, if you want to do it, let the patient ask you,
Mm.
but don't raise it by yourself. The examiner will minus you, and in the judgment he will say you invent, because it's not of the
Mhm.
management plan right now. Yes, it's one of the possibility, but don't raise it, because we are now talking about firstly about the insulin, how to inject and what time to inject, and the explanation of manifestation of hypoglycemia, the complication of missed insulin, but not the time to talk about insulin pump. If he asks you,
Mhm.
doctor, what other solution I should have or I would have in the future if I'm not tolerating this insulin injection, you can tell him about there is a possibility of insulin pump. So whenever the
Okay.
plan or
What
the
what
task,
what's the concern? Yes.
yeah,
What is the concern regarding the insulin pump? We can come.
yeah, he will ask you, doctor, any other solution I can have or I can do instead of these injections.
Mm-hmm.
That time you can tell him, yeah, there is
Yes.
what we call it insulin pump. It's one of the pumps can be put under your skin, and it can sense your blood sugar, and immediately it will inject you the insulin with automatically without even you feel it. Okay,
Mm-hmm.
this is the way, but don't raise it by yourself, don't give it as an option,
For the needle
because
phobia, no, not options. Okay.
not it's advanced option if he insists not to give him this insulin. But the for needle
Mm-hmm.
phobia, it's not needle, it's small pin. It will prick you and you will not feel it, and no pain with it, just a prick. Okay,
Mm-hmm.
if he insists for something else, you can raise it. Clear?
Clear.
For type 1, Dr. Sarah, always remember what we call it CGM, continuous glucose monitoring. You know it? You know the system?
Yes, yes, yes.
Yeah.
Bump also.
No, it's not pump. It's
Device.
sensor.
Sorry.
Yes,
Device.
it's a
Device. Yes.
device. Yeah, it's a device or sensor device.
Mm.
It can be stick to your skin in your arm, and by
Mm.
this way, easily check your blood sugar without breaking yourself. And it can give you alarm that your blood sugar is going down. Okay, easily check, easily connected to your phone. You
Mm-hmm.
can read your 24 hours blood sugar without breaking yourself. Clear? So in this
Okay.
scenario, you have to talk about it. Why you don't have the time to talk about all these things? Because you spend time and a lot of time to explain about the pathophysiology of diabetes. Again, if you want to explain, yes, you can draw, but just shortly, you have a defect in insulin protein from your gland in the tummy called insulin from the pancreas. And in your condition, it might be with no reason. In certain other condition, it might be due to defense system misdirection. You want me to explain about the manifestation? Yes, doctor. It can comes with hyper or high blood sugar, and the high blood sugar, you will feel thirsty. You will feel going to the urgence. I mean, and you will go to the bathroom many times, even while sleeping. With the time, there is a long-term complication of diabetes. It might affect your nerves. It might affect your heart. It might affect your blood channel. It might affect your brain. I'm talking about retinopathy, nephropathy, and the neuropathy. Okay, major and minor vessels. So you are talking about stroke. You are talking about heart attack. What or when this happen? If your control is or your blood sugar is uncontrolled well. So there is what we call hemoglobin A1C, which is 3 month reading of your blood sugar. Our target to be around 7. How to control it? With artificial insulin or with insulin from outside. Because in your condition, you don't have insulin. Doctor, is it important to take insulin? Yes, it's important. Doctor, can I take the medicine or pills? No, in your condition, no chance to take it. I'm sorry to say that. Okay, please, doctor, I want to take. So you ask him why you don't, as you did, why you don't want to take it? Because I have phobia. So there is a solution. There is a pen with a small, very minute spin. Even you cannot feel it. It will inject you within seconds. You will not feel it, and the manifestation of hypoglycemia and the driving issue the smoking issue, the alcohol issue, the job, very important in this scenario, and thank him. At the end, you can give him leaflet brochure and website. See, in 3 minutes, I make it, or I made it in 3 minutes. The manifestation, the complication about the hyper or hypo, and the pathophysiology, and the do you smoke, and do you questions. Is it clear, Dr. Sarah?
Yes, clear, doctor. Thank you.
Most welcome. But don't worry, you are doing fine. You are trying to do it well, but don't rush to give information. This is what I feel in this scenario. You want to give him information. No, the patient or the surrogate in the PACES exam, he want or she want to talk more. He want to give you concern and you will answer him. It's not a matter I should explain to him. No, it's a matter of how to address his concerns or how to answer him. So the good
Okay.
listener, be good listener, you will gain a lot of marks. But if you be talkative or you are the one talking, you will lose a lot of marks. You got it?
Yes, yes.
Okay, you have any question? Dr. Ayula, anything missed? You think we should add? Driving is very important, by the way, Doctor.
No, thank you. Nothing from my side. Thank you.
Yeah,
Yes,
thank you too.
regarding the driving,
Yes, driving. Whenever he will have hypoglycemic attack, he should inform his GP, and if repeated, he might stop driving. Clear?
mhm.
So the first time, it's okay,
I
but
think
you
just
will
in the
warn.
unawareness of hypoglycemia, the driving stop, but I'm not aware regarding hypoglycemia
No, no,
itself.
not only unawareness, even the awareness one. Any hypoglycemic attack or recurrent hypoglycemia, the first one is alarming. The second one will stop driving. But you will tell him he should avoid, sorry, he should avoid hypoglycemia. Why? It might stop his driving because of it. Okay?
Okay.
Okay, thank you, Dr. Sarah. Thank you, Dr. Ayula. Any question from others? I hope it was clear scenario. Anyone has doubt about how to do it? It's common scenario, by the way. It comes many times. It's not tricky. It's straightforward, but need from you to be shortly talking and answering the concern. Even if you want to explain, just explain in a simple way. Okay, let's read the comments. What should be the advice regarding driving? Yes, I mentioned just now. Thank you, Dr. Ala. He can drive now, but whenever he will have hypoglycemia, he should inform his GP. If it's recurrent, he should stop driving. Could you repeat the advice regarding the driving? Again, Dr. Tasneem, whenever he feel or he had hypoglycemic attack, he should inform his GP. If recurrent one, he should inform DVLA and he might stop driving. So the DVLA after second attack. Okay, clear? Yeah, regarding the job, the military, pilot, or sportman, football player, he should have some advices regarding his fitness. He couldn't be fit for this job. If he insists and the company accepted, they can reallocate him. They can reallocate him. So it depends on the company, but you should give him advice. So you will tell him your job is risky to have it whenever or while you are having this condition. So you might give him the fitness paper and the company either to accept or to reallocate, or he will not. For example, for the pilot, he might not fly again. They can reallocate him in the office job, in the army as well. So let the decision to be for the sponsor. But you have to advise him that his job will be risky, that he might have the hypoglycemia because of the exercise, and if he has it, it might threat his life as well as the others. If he's, for example, pilot, so he should be away from this job. Clear for all? Any question or comment? Missed point? By the way, it's not necessary to write the question. You can raise it. I'm not restricting. I am even unmuting all. Anyone want to unmute, he can talk.
السلام عليكم دكتور باسم.
وعليكم السلام ورحمة الله وبركاته. Yes.
Excuse me, I'm asking about definition of diabetes mellitus type 1 in a simple way to
Yes.
explain the patient.
Perfect. Good question. So, as Dr. Sarah did, and I will repeat it, it's one of the disease happen due to a defect in your gland called pancreas. And this pancreas is secreting a protein called insulin. Whenever there is a defect in this protein, you might have high blood sugar in your blood. And the symptoms will be high blood sugar will lead to either feeling thirsty all the time or feeling urgency. So you will go to the washroom many times, day and night time, even while you are sleeping, in a simple way. Why it happened? It's
Yeah.
unknown. But type 1, most of the cases, it might happen due to this defense system misdirection. So the defense system, instead of attacking the bugs, it attacks your pancreas. And the pancreas will be defective of this protein. I
Okay,
hope it's
thank you.
clear. Okay, clear.
Yes, yes, thank you very much. Yes.
Okay, do you think diabetes type 1, one of the bad news, you should break bad news for it? Dr. Sarah, are you still here? And I
Yes,
think you
yes,
did it. Yes, so
yes.
although it's curable
Yes,
with pancreatic
yes, bad
transplant,
news.
yeah, although it's curable with pancreatic transplant, however, it's carry a lot of complication. It's a disease for long term. Either he will have complication from the disease itself, like I mentioned, stroke, heart attack, or even retinopathy, neuropathy, nephropathy, or hypoglycemia due to the medication he received. Even if he has in the future transplant, pancreatic transplant, he will have complication from the immunosuppressant. So I don't think the patient in a place to hear good news. I hope it's clear for all, and you all of you are agree for that, right?
Yes.
Okay, I answer you, Dr. Salma, right? Any other question? Yeah, diet
Yes,
advice.
thank
Thank you,
you very
Dr.
much.
Naham. Yeah, thank you, Dr. Diet advice is very important. You should be followed with the diet specialists, as well as group of doctors. Okay. Anyone with question? Okay, if no more question, see you tomorrow, inshallah, with long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Yes, hello.